Right, this should be us then live. I see people joining just now, so we'll give it a few minutes and allow attendees to sign in. I should, why don't, at the during this, I can share the screen with the background slide just so that we have it, so people know. Right. And give it just a couple more minutes for people to arrive, and then we'll start. Right, seems to have leveled off on numbers. Right, so in the interest of time, I will go ahead and introduce what we're doing, and we'll allow people to just join as I ramble on for a few minutes, as I tend to do at the beginning of these sorts of things. So welcome everybody to our University of Glasgow Stevenson Trust COVID-19 panel. We're really happy everybody could join us. And unfortunately, we're not face-to-face in the Sir Charles Wilson building yet, but one of these days we'll return there. So this is our second event, trying to use the online Zoom features. We're trying a slightly different format this evening. So tonight we're using more of the webinar functionality with Zoom. We very much appreciate everyone joining us for this live yet virtual panel session, exploring the health, social, economic, and of course, political implications of the coronavirus pandemic. This is obviously a timely session for us as we seem to be heading toward another resurgence in the number of people testing positive for the novel coronavirus across the UK and many industrialized countries. Of course, this is going to have massive impacts socially, economically, and politically. Now, it's possible to look at this panel and wonder why the Stevenson Trust for Citizenship is doing a panel on this theme. We've put this together because we believe, and if you're joining us tonight, I suspect you probably would agree with us, that the pandemic has had a rather substantial impact, not just on public health, but also on our social and political institutions. So we plan to look across the spectrum of these this evening. And of course, the remit that we received from Sir Daniel Stevenson back in 1921 was to look at issues affecting citizenship on a local, national, and international scale. And I think certainly this topic hits that mark. Just a note on the format, each panelist has been asked to speak for about 12-15 minutes or so. Following their presentations, we will have a Q&A session, so you can use the Q&A functionality in Zoom to post your questions. Feel free to start posting questions when they occur to you, and then we will get to them during the Q&A session. We're still, as I said, experimenting a little bit on different functionalities, so please excuse me a little bit if it gets a little bit clunky when we get to the Q&A, but I'm sure we'll make it all work. And just finally, before I turn over to introducing the panelists, some programming notes. On the 8th of October, we are very pleased to have the inaugural Stevenson Trust Donald Dewar Memorial Lecture that we will be hosting, being delivered by the Right Honourable Lord Jack McConnell, who will discuss the legacy of Scotland's First Minister on the 20th anniversary of Donald Dewar's passing. Following that, on the 27th of October, I will be discussing the US presidential election and other elections. And then on the 17th of November, I'll be trying to figure out what it was that happened, if we actually know by the 17th of November what it was that actually happened. So we'll get there, and hopefully we'll have something to say about that. Well, I'm sure I'll have something to say about it on the 17th of November. We'll find out what that is. Right, enough on the programming notes. Let me introduce our speakers for this evening. In this running order, first, Dr. Antonia Ho, who will be speaking on health and health implications of the novel coronavirus. Dr. Antonia Ho is clinical senior lecturer and consultant in infectious diseases at the Center for Virus Research at the University of Glasgow. Her research focuses on the clinical epidemiology of influenza and other respiratory viral infections in the UK and sub-Saharan Africa. This has included the novel coronavirus since February 2020. And indeed, quite impressively, she's published 7 articles on the emergence, epidemiology, treatment protocols, ethnicity implications, and global responses to COVID-19 this year in the British Medical Journal, Lancet, Journal of Infectious Diseases, and others. Tony is a member of the Department of Health and Social Care Scientific Advisory Group on COVID-19 testing. Next, we'll have Professor Sir Anton Muscatelli, speaking about the economic impact of COVID. As our Stevenson regulars will know, Sir Anton is Principal and Vice Chancellor of the University of Glasgow and former chair of the Russell Group of UK universities. It would take far too long to list off the number of advisory councils and groups that Sir Anton sits on, but he is currently on the Scottish Government's Council of Economic Advisors and the Scottish Government's Independent Advisory Group on Economic Recovery in response to COVID-19, and is chair of the Scottish Government's Standing Council on Europe. Then we'll turn to Professor Sarah Armstrong on the effects of COVID on society and particularly marginalized groups. Professor of Sociology at the University of Glasgow, Sarah is the Director of Scottish Centre of Crime and Justice Research based at Glasgow University. She is co-PI with Dr. Lucy Pickering of a Chief Scientist Office Rapid Response Project on COVID-19 suppression effects on vulnerable groups. And then lastly, we'll turn to Professor Sir John Curtice on the political implications of COVID, Professor of Politics at Strathclyde University and Senior Research Fellow at NatSen. Sir John is, of course, our honorary Stevenson Fellow here at the University of Glasgow, and we very much appreciate his regular contributions to our Stevenson events. Finally, I'd like to thank Dr. Karen Wright, our Stevenson Fellow, for putting this all together. It was a rather impressive feat to pull together this panel and bring it to us this evening. So thank you, Karen. With that, let me turn it over to Dr. Tony Ho.
Thank you very much. Oh, you need to enable screen sharing.
Oh, I'm so sorry. Right, that should be you now.
Yep. Great. Can you see my slides?
Yes,
my slide?
Yep.
Great. Make a start. So thank you very much, Chris, for the introduction. I'm an infectious disease doctor and a clinical epidemiologist. And Karen had asked me to talk about the impact of COVID-19 on public health, challenges and opportunities. This in itself could probably be an hour-long talk. So I kind of sat there and gathered my thoughts and just thought I would present kind of a brief overview initially of the challenges that we've experienced over the last 6 months and opportunities this pandemic has offered. So I guess it's no surprise to anyone that COVID-19 pandemic really delivered a profound shock to the country, you know, both in terms of health, but also affecting every aspect of life. I mean, the NHS was radically mobilized to respond to the kind of needs of people infected with the virus. it responded very quickly to really change the way we deliver healthcare, prioritizing patients with COVID-19, but also trying to deliver this kind of scaled back healthcare for non-COVID-19 patients. And at the same time, kind of public health departments and local government also reshaped the way they work. So, you know, we do have surveillance systems for influenza, and that was kind of adapted to accommodate COVID-19. As you can imagine, there were a number of challenges initially in setting up the testing, and over time to provide the data we need to really understand how COVID-19 is affecting us. The initial focus was, of course, at the kind of sharp end of the crisis to kind of identify the number of people who were presenting to hospital, and also the number of deaths that occurred due to COVID-19. But over time, you know, testing capacity increased, and we are now able to generate near real-time data in terms of the number of cases, and that's in time included laboratories, the lighthouse laboratories that do the vast majority of community testing, to give us an idea of community as well as hospital cases as well. Sorry, just trying to move my slides. What there has been is there has been obviously a substantial change in the way that patients present and also healthcare seeking behaviours. In primary care, there's been a major decline in consultation, switching to kind of remote consultation, and also substantial reductions in referrals, tests, prescriptions, and immunizations as well. In secondary care, there was a sharp drop in the number of A&E attendances, also fewer referrals with cancer, and also increase in cancellation of planned treatment and long-term conditions. In terms of surveillance, you know, we need to kind of understand what this means in the long term, but also kind of traditional methods of surveillance no longer work. For example, we often monitor flu-like illnesses, colds and flus in the GP surgery, but we can no longer do that if people are not going to the GP surgery. So new methods need to, we need new methods to identify trends in presentations. I think one of the key challenges really that has struck me in the initial couple of months was how fast the pace of information that was coming through. You know, in the first couple of months, you know, most of the data that was coming out of China and later on in Italy, it was really kind of dizzying, and public health in particular needed to generate guidance very rapidly to keep up with that evidence, and it was constantly evolving. And I've now, this graph kind of displays the policy tracker in terms of the timeline of national government and health system response to COVID-19, and the types of policy in terms of narrative, measures to limit spread, health and social care response, broader policy measures. And that's just from the first 180 days of 2020. And it was really, really challenging to keep up with it. In terms of the messaging to the public, because remember, public health provides advice and information not only to healthcare professionals, but also to national government, to the general public. So it's really key, the messaging, as well as managing scientific and epidemiological advice, as well as you know, the politician, you know, ultimately it's the politicians that make decisions. Another key challenge thinking is that public health isn't just involving surveillance, monitoring, and emergency response, which is what we often think of what public health does. But actually it involves in many spheres in terms of health protection, health prevention, health protection, as well as promotion. And in terms of surveillance, it doesn't just monitor respiratory viruses. During the last 6 months, a lot of attention and resources have been diverted from other areas. And there's been challenges in terms of the, you know, the number of people who are available to work in surveillance. And, you know, looking ahead, there are long-term impact in terms of mental health and maybe even the long-term effects of COVID-19 that still need to be monitored. And currently, the challenges are, how do we continue to test and do surveillance for other important pathogens such as influenza coming into this winter season when a lot of the resources are currently used for COVID-19? And that's something that we're trying to address just now. So that are some of the kind of key challenges I've kind of seen over the last 6 months or so. In terms of the pandemic, was it a surprise? Was it something that we could have expected? And the answer is absolutely yes. This is a kind of map including the number of new and emerging disease infections that have come about since 1998. And just, over the last 15 years, the key ones I can think of in terms of SARS in 2002 in Hong Kong and China, MERS coronavirus in 2013, the pandemic influenza in 2009, and until now. We know that these are occurring more and more, and that is probably multifactorial with increasing interactions with humans and animals, as well as insect vectors, and also mass population movement. I don't know if you've come across Bill Gates' TED Talk. He did a very prescient TED Talk back in 2015, suggesting that we are really not prepared for the next outbreak. He kind of highlighted at the time that the Ebola outbreak in West Africa really showed how underprepared we were. He highlighted that there were little investment had gone into system to stop an epidemic, and that it was really a priority, and that the key was to strengthen health system, particularly in poor countries. And we ought to take advantage of advances in science in terms of mobile phones, satellite maps, the availability of sequencing to determine genetic codes of pathogens, if we devoted resources to them. But have we really listened? To an extent, but not entirely. So in terms of some of the things that have been put in place in order to help public health response, both in the UK and worldwide, the kind of Coalition for Epidemic Preparedness and Innovation, or CEPI, was set up back in 2017. It was a global partnership to develop vaccines to stop future epidemics, which was funded by the Bill and Melinda Gates Foundation, Wellcome Trust, as well as a number of governments, including the UK government. And this was very timely because when the COVID-19 pandemic came about, it rapidly invited applications to develop COVID-19 vaccine platforms. And to date, they funded 8 of these platforms, 3 of which are currently in phase 3 trials, so large-scale human trials in the UK, and hoping to deliver some results by the beginning of 2021. From the 2009 flu pandemic, it was also noted that there was very disparate clinical research using different methods, different design, and a real recognition to harmonize clinical research. So the AZARIC consortium was set up, and it now has over 50. It now has 50 clinical research networks representing 132 countries, with the aim of kind of rapid, coordinated investigation of emerging infections. And they've also developed a kind of WHO validated clinical data collection tool that allows us to do harmonized data collection for emerging infection that can be adapted, that's pre-approved, and it's lying dormant. So this protocol was approved for the UK back in 2013, has been used a number of times for the Zika virus, as well as MERS coronavirus, and was activated in mid-January for COVID-19. And the AZARIC 4C consortium was set up, and I am part of that consortium. I coordinate the Scottish recruitment, and we have to date recruited over 18,000 patients who have been admitted to hospital with COVID-19 and have generated an enormous amount of information, allowing us to really understand how patients present, what complications they have, to kind of help define treatment plans, for example. And importantly, the data platform, it feeds into the Scottish and UK government. So this real-time reporting is really useful for the government to really understand the epidemiology of UK patients. We have also developed unprecedented capacity to do genomic sequencing. So this is, a method to understand the genetic code of the virus. The syndrome was of these acute severe pneumonias of unknown etiology was described at the end of December. And by the 10th of January, we've managed to find out what that virus is. So that's incredible. And to date, there's been over 114,000 virus genomes that have been generated. And it's loaded on a global platform that was originally set up for influenza. Data sharing allows us to really understand in real time how the virus is spread. This information is key to designing and evaluating diagnostic tests, track and trace ongoing outbreaks, and also identify potential treatment options. In Scotland, we're also part of the COG UK consortium. So there was a large consortium involving a large number of universities to set up the sequencing capacity. One of my colleagues, Professor Emma Thompson, leads this work for Glasgow, which is done at the CVR. And this work suggests we were able to identify over 100 introductions of the virus to Scotland, mostly from other European countries, including Italy, Austria, and Spain, and also allowing us to identify localized outbreaks in residential facilities and healthcare facilities, and also a large international conference. So this data is enormously powerful. We've also made use of, lots of more innovative approaches. We've now applied lots of data platforms and systems that have been developed for COVID-19. A lot of the routine clinical data is now entered into an electronic app that is entered in lots of accident emergency departments, which can be used for a lot of clinical studies, and of course the Test and Protect, the Protect Scotland app as well. And perhaps these innovations could be applied to other diseases. We now use a lot more remote consultations, and of course, it will never replace face-to-face consultations for a lot of interactions between patients and doctors. But to an extent that it could be adopted for certain interactions. And perhaps we need to think about kind of more innovative surveillance platforms. For example, environmental surveillance for SARS-CoV-2 using kind of wastewater has been suggested. This kind of approach is already used for diseases like live polio, as well as to monitor antimicrobial resistance. But it's already, a number of publications have appeared looking at this, and its potential uses could be an early warning system. Could we do routine sequencing of wastewater as a kind of early warning system, as it has been shown by a number of studies that it can appear in the sewage before it appears in increases in cases that have been detected. Or it could be used to detect SARS-CoV-2 in locations with limited clinical surveillance. And lastly, it could be used alongside clinical surveillance to monitor circulation. What about a different approach? I've decided to include this really interesting comment that was published by Richard Horton, who is the editor of The Lancet. He argued that the current approach we're managing this pandemic is far too narrow because we're focused just mainly that SARS-CoV-2 is an infectious disease and all the interventions have been directed at curbing viral transmission, when there is a clear interaction between COVID-19 and non-communicable diseases, and the latter are clearly clustered within socially disadvantaged groups. And I think Sarah is likely to talk about this. So he argued that a syndemic approach should be used. And for those unfamiliar to this approach, it kind of looks at biological and social interactions. And this was described by somebody called Meryl Singer, an American anthropologist, back in 2017. And Richard kind of concluded that addressing COVID-19 means also addressing all these kind of chronic diseases. And unless governments devise policies and programs to reverse these disparities, then our society will never be truly secure from COVID. And lastly, I think we need to learn from this pandemic and how to better prepare for the next one. I think there has been, the need for surveillance and strong public health system has been justified, but it's clear from the experience of the last 6 months that preparedness needs input from a wide range of disciplines and sectors, epidemiologists, economists, behavioral scientists, data scientists, molecular scientists, and also involving industry, and that we cannot work in silos. I was heartened to see that Dame Sally Davis had set up this new global coalition called the Trinity Challenge, which includes kind of data science and public health. And the aim was to use data, advanced analytics to identify better ways to predict, prevent, and respond to outcomes. And the kind of founding members include a lot of industries, universities as well. So I think I've taken way more than 50 minutes. I apologize. I'm sure Karen's been waving. But I just want to acknowledge some of my colleagues in Health Protection Scotland, and I've left my contact details. And thank you for listening.
Thank you very much. I think we would all prefer a much longer take on that, and maybe we can do another Stevenson talk on that at some point. That was really, really interesting. Thank you. So next we will turn to Sir Anton. And I think, are you set for your screen?
Yeah, I think I'm starting to share. Chris, if this is okay.
That's it. Perfect.
Okay, well, thank you very much for the invitation to participate. And like Tony, I will try and get through this very quickly, but I could have, most of us could speak for about an hour on our topic, so I won't keep it short. I mean, just as the pandemic has been a massive health shock, it's had a massive economic effect, and it's an economic effect, an economic shock like we've never seen before. I know people try to make comparisons between the COVID economic shock and previous crises, but to be honest, we haven't seen anything like this. Partly because the world, as Tony said, is much more interconnected, and the last pandemic on this scale, which has affected so many countries, was really in the early 20th century, and the transmission was different. It didn't impact on the economy in the same way, partly because social consumption is just so much more important these days. And obviously the impact has been huge. I would say that the key thing in understanding the economics of COVID is really to try and understand how uncertainty impacts on consumer and investment spending. And this is what government's been trying to offset through its policy interventions. And some of that uncertainty will undoubtedly be affected by some of the efforts around vaccines that Tony talked about. If a vaccine were to be found to be effective in the next couple of months, it would have a huge impact, positive impact on the way in which consumer and business respond to this, and it would help economic recovery. But if it doesn't, if we have to live with the virus for 2-3 years, it will have a very different impact. I wanted to give a feel for the importance of the fiscal response to this shock, because across the whole world, we've seen governments responding by, as I said on the previous slide, through support of employment, through government-sponsored loans to business, through other attempts to help companies of all sizes to find their way through the crisis. And the size of these fiscal interventions are absolutely massive for times of peace. And you'll see that in this particular slide. As a percentage of GDP, the sort of downturns that have been experienced have been matched by massive investments by all countries. And again, the figures are on the bottom of the slide. There are, we've seen essentially a much bigger response this time in fiscal terms than we saw in the great financial crisis. If you look at the more advanced economies, we've seen a much bigger spending or tax cuts than we saw in response to the 2008-9 financial crisis. But there's no doubt that we've seen more of a response in the advanced economies simply because of fiscal capacity than we've seen in, say, some of the G20 low and middle income countries. And one thing I'm not going to go into detail simply because of time is that COVID, the impact of COVID on the economies has been uneven around the world. And we'll see the legacy of that in the next few years. Many low and middle income countries will suffer for much longer, perhaps, than some of the advanced economies. And again, I won't say much about the impact across society, because I know Sarah is going to touch on that. But again, COVID will not impact equally across society, for, as Tony also mentioned, particularly the young, because of the impacts of COVID on educational transitions, but also because of the impact on lower socioeconomic groups will be very different than on those who have greater means. So that has to be recognized at the outset. But apologies, I don't have the time to go into that level of detail. So if you look at the UK, if we narrow our view to the UK, one of the biggest interventions was the so-called coronavirus job retention scheme, the CJRS or furlough scheme. And this is a huge intervention in terms of the size of fiscal spend in the UK. It provided up to 80% support. It's been tapered. From November, a new job support scheme has come into effect. It's not as generous. That's the key point to take from this slide. And in addition, there's been other types of support around self-employed income support. Again, that's winding down, and some business grants. I mean, the total size of spend by the UK government, the fiscal package is 192 billion, of which most of it in spending and some of it in reduced taxes. And I'll show you in a moment, just a bit later on, just how big that is relative to the size of the economy. Just one slide only on the so-called monetary policy response, although quite a lot has been said on this. It's not just that governments have been spending more and borrowing more to finance that spend. That borrowing, that debt that governments have been issuing has been where the countries have got their own central banks, has been purchased by the major central banks. So the Bank of England for the UK has been buying a huge amount of government debt to try and help the government finance this. Now, some people call this printing money. It's a bit more complicated than that because it's a temporary monetary accommodation, and I could go into detail in subsequent discussion about what this means. It's not printing money in the conventional sense, but it is a monetary accommodation and it does expand the monetary base. And the potential implications of this is that if there were to be a recovery and that monetary overhang was still there, it could lead potentially to inflation. But at the moment, it was exactly the right thing to do. If it hadn't been done, it could have caused a real fiscal crisis. And all the major central banks, Bank of England, the Fed, European Central Bank, they're all doing something very similar. Now, it's really difficult to predict what happens next. You will have seen in the press a number of attempts to characterize the potential recovery from the COVID shock. All we know, and I think that first quote from Yogi Berra is probably one of the best quotes I've seen associated with this, that basically the future in what it used to be. We simply don't know what's going to happen over the next 2 years. My best guess is that what we have is not a V-shaped recovery, in other words, an immediate bounce back in economic activity. Probably not the economy stuck in a rut once we see an improvement in the health situation, but probably an elongated V, probably what some people have called a Nike swoosh. Although, I mean, with a second wave apparently on the way in all over Europe as well as the UK, of course, it's not impossible that we might also see a second dip and more of a W-shaped recession and then hopefully a recovery. And we've seen the initial economic recovery as lockdown began to be unwound during the summer. Some of the measures began to be unwound. But it's only the economy, both in the UK and many other European economies, has only bounced back a little bit. And in Scotland, actually, the picture is very similar. GDP increased by 6.8% in July. I mean, this is huge. These are huge figures on a month-by-month basis. And if you take UK GDP figures, if you take any sort of given quarter over the even going back to the 2008-9 recession, it didn't shrink by more than 2.1% in a quarter. Instead, in Q2 of this year, it fell by 20.4%. So these are huge figures. Now, again, I'm not going to go into one aspect of this, which is the measurement problem. There are different ways in which GDP is measured across countries, and some output is linked to economic activity, even though salaries are still being paid. For instance, when school education ceased in the UK, that impacted on GDP figures, but salaries were still being paid as school teachers. So it's a bit more complicated, but I won't go into those sorts of detail. And this gives you an idea just of the size of the shock. This is a monthly index of GDP. And on the other side, you see exactly how that's distributed. And as you would expect, essentially, some of the biggest dips were in activities that involved a lot of social contact, such as construction, such as food and accommodation, and so on. I think the thing to remember is that even as we've seen a recovery, even as we've seen rather a sort of rising again of health cases, already economic activity was beginning to slow. This is data from Google Retail and Recreation Community Mobility Trend, and also the so-called PMI index. The PMI index gives you an idea of whether consumer spending is increasing or falling. And if the number is over 50, then it's heading in the right direction. If it's not, it's shrinking. And we're beginning to see a recovery following the months of lockdown, but actually we're beginning to see that recovery tailing off, which is one of the reasons why many are thinking that the recovery will be slow. And of course, the problem is that once the recovery begins to slow, then when schemes such as the CJRS begin to wind off, like the furlough scheme, and if the scheme that's replaced it isn't as generous, we might see unemployment rising. Once unemployment rises, then you have these an impact on consumer confidence, because people will spend less because they're worried about their jobs. Businesses will invest less because they're worried about the ability to sell. And that then leads to a cumulative effect, which means that the recovery isn't V-shaped, but becomes very much more like a Nike swoosh, or perhaps even much more like an L, which would not be a good idea. How big is this fiscal effort? I said I would say something about it here. It's basically the biggest peacetime fiscal effort we've seen in most countries. This chart shows you calibrated on the right-hand axis, the debt to GDP ratio in the UK. On the left-hand side, the borrowing as a percentage of GDP. And the sort of deficits we've seen since the crisis really are the biggest since wartime. During the war, we were running deficits in the UK, during the Second World War, deficits of the order of 20 to 25% of GDP, and now we're getting to about 15%. Debt as a percentage of GDP, this is a central forecast from the IFS, will possibly peak at 100% of GDP. However, in a downside scenario where there is a second wave that actually takes hold and requires a second national lockdown of the scale we saw in March or April, that could easily rise to about 120% of GDP. Now that takes us back to the late 50s, early 60s, when the UK was still beginning to try and pay off its wartime debt. That's as bad as it is. And of course, some of this debt, as I said earlier, is being bought by central bank, but it can't, that can't be a permanent thing. Eventually that will need to be wound down, that quantitative easing. So the question is, how do we find our way through this? It's a difficult period, and can we find a middle way through? We're now, of course, in a period where restrictions are being reimposed. And there is a pessimistic scenario that the OECD has published, which sees if there were to be a reimposition of lockdown measures, which will hit consumer confidence, as I said, will drive down business investment, and could increase government debt by a further 6% of GDP. And frankly, we would then see probably the biggest, certainly, world recession on record, certainly since modern times. And so can we find a middle way? Now, this has led to a kind of health versus economy debate, which I personally think is misplaced, because, and I'll show you a chart in a moment, in my view, there isn't, when you're in the height of a pandemic, when you're in the height of a wave, there isn't an economy versus health type scenario, because actually consumers, frankly, are even if you were to reduce restrictions, are worried about their health, are worried and will simply not go out and spend, and will simply, because of effects on confidence, will reduce their spending. And actually, there's a very good analysis of some of these trade-offs in a very good British Academy paper, which Nick Stern and Tim Besley have published. It's actually, there's a whole field that's emerged since the pandemic called epimacro, which tries to combine epidemiology with macroeconomics, which tries to look at some of these trade-offs. And I think what's important here, and what I would stress, is that the trade-off between relaxing restrictions in order to benefit the economy really only work if the pandemic isn't in full swing. Because if the pandemic is in full swing, frankly, consumers, families, individuals are too scared to take advantage of any reduction in restrictions. And there's this wonderful example between Sweden and Denmark, because as probably most of you know, Sweden had a very different approach to the lockdown. It didn't restrict individual liberties in the same way, whilst Denmark had a complete lockdown. Very similar countries, very similar geographical locations, so they were probably affected in a similar way. But actually GDP and consumer spending fell by a similar amount in Sweden as it did in Denmark, which is not something that when people tell you about the Swedish experience, they don't often tell you about this, which I think is quite important. So there are no quick fixes. I think, there have to be attempts to try and find a way forward. But ones that are more nuanced and look at also trying to provide greater security through the kind of health system protections that Tony was talking about. This is, I think, one of the most interesting charts that I've seen on this. And now it's a snapshot. It only tells part of the story. It's a particular cut on the data. It focuses on the 27 EU countries plus the UK. It plots the fall in GDP in the first half of 2020 against the cumulative deaths per million as of the 21st September. And what you see is essentially the countries which have fared rather better, which are the ones in the northwest quadrant, countries like Norway, Finland, Denmark. They've had fewer deaths and a smaller economic hit in relative terms. It's still been a big fall in GDP, as you see, of the order of between -5 and -15%. And then you'll see those countries that have been affected worse. So France, Italy, the UK, Spain, and Belgium with a bigger economic hit, but also essentially much more deaths. And you'll see Sweden here. Sweden did have sort of a smaller economic hit than some of the countries in the bottom right-hand corner. But actually, when you compare it to Denmark did better, even though it had more of a lockdown. So it isn't quite as straightforward. You need to look at the details of this. Germany, for instance, as we all know, has an excellent local public health system. They had a very effective test and trace system, and this may have contributed to its outcome. But of course, there are many other factors at play here, and this is what has to be recognized. Some countries were quite unlucky. If you look at the way in which Italy's pandemic evolved, it hit care homes and hospitals very quickly, and therefore had a very different evolution from the way in which the German one worked out. And that might have had an impact also on the trade-off. So very quickly, some concluding thoughts. One of the big issues, and one of the big debates that's happening in the UK at the moment is, when should you switch the fiscal effort from supporting existing employment to supporting aggregate demand and spending? And this is really important because, of course, one of the worries in all of this is that we are supporting existing jobs, but actually those jobs may not necessarily be viable post-pandemic, either because the companies are saddled with debt and will not survive once the pandemic ends, or because in some sectors those activities will no longer be relevant to a post-COVID economy. So the question is when do you switch that support from employment support, current employment support, to job creation? And that's a key. It's a difficult decision for governments. The other big decision is, what do you do around monetary policy? Do you need to do more on the monetary policy side? Some people have suggested that helicopter money, which is not quantitative easing, it's actually much more active spending, where government actually spends money and the central bank prints it at the same time. And some people have suggested, rather than borrowing money with bonds that are dated as is normal in most advanced economies between, 10, 20, 30, 40, 50 years, that we should issue even perpetual bonds, which is the kind of long-term irredeemable debt that were issued by countries like the UK during the Second World War. I think we have to avoid a return or threat of return to austerity post-COVID, because I think that would really have a negative impact on uncertainty. I think the dog that hasn't barked yet in the COVID economic crisis is the potential for financial crises, because there will be companies, there will be a number of organizations that will have borrowed to try to fight their way through the crisis. And if the crisis lasts longer than expected, they may not be able to repay this. And so this is a really big issue. Tony said we need to prepare for the future. We should have known about this. And I think, yes, we can't assume that the next pandemic will not happen in the next decade. And therefore, we can't disinvest in the test, trace, track, and isolate technology going forward. We need to keep that in place. One of the big issues here for me is that when you have a wartime type economic shock, which I've referred to already, then actually often what you find is that infrastructure is destroyed because of wartime destruction. And then you rebuild with new technologies embodied. Now, the COVID shock doesn't do that for you, because actually everything, existing companies, because of government support, existing activity all stays in place. But there's this issue of how you invest in new technology. And again, green technologies, public R&D spend, particularly on dealing with the next challenge, whether it's climate change or the next health challenge, have to be upfront there. And I think, I think it's probably going to lead to more interventionist government in the medium run, simply because the COVID shock will be so deep. And the final recommendation is don't erect international trade barriers. We've seen what's happened in terms of the relationship between the USA and China. We, of course, have EU-UK negotiations on the Brexit trade deal. Really, we must avoid a further economic shock due to protectionism. That would be really poor indeed. And I'll stop there. Sorry to have run slightly over.
Thank you, Anton. Yes, I imagine that the media is going to have quite a hard time figuring out what to focus on when we get to the Brexit talks, even heating up a little bit further later in the year. We'll have you come back and discuss that one if you don't mind. Next, before we turn to Sarah, I'll just say to everybody attending, feel free to use the Q&A and leave questions as our speakers are speaking. A few people have begun to do that, but please do feel free to put in questions. Right, we'll turn next to Sarah. Thank you.
Hi there, can you see my screen? Is that sharing working?
It seems to be working.
Okay, great. Thanks very much, Chris Carmen and Karen Wright, for organizing this and inviting me to speak on behalf of our project. As mentioned, I was asked to talk about the social impacts of the COVID-19 lockdown for particular groups, and I'll be reporting on a study that I'm doing leading with my colleague Lucy Pickering. Just to give some background information about this piece of research, we are working on a 6-month rapid piece of research funded by the Chief Scientist Office that has been running from June and will end at the end of November. We're looking at 4 different groups, 4 different people affected in different situations, and I use these abbreviations later in the presentation, so I'll explain them. They are people affected or involved in the criminal justice system, including being in prison or on supervision, or the loved one of somebody who is, being a domestic abuse or sexual violence survivor, having a disability or living with a long-term health condition, and people who are refugees and asylums are involved in those systems and are facing destitution, for example, if they've been denied recourse to public benefits. While these are 4 distinct groups, in many ways, we wanted to look across them to understand shared and distinctive features of how people who already are experiencing or facing significant levels of harm, isolation, and exclusion are being affected by the restrictions imposed by lockdown and the risks created by the pandemic. I wanted to give some information as well to share with you that this is a huge effort that's being undertaken in a condensed period of time. And I think that it is typical of any research happening on COVID right now, that there's just armies of people working to try to get information as quickly as possible. We have a 28-member team, including 18 investigators who are colleagues in sociology, plus 8 RAs and 2 administrators. And all of us are working on this on a part-time basis. And where RAs, for example, PhD students are giving us time away from their PhD research to help out. We're also working with 20 partner organizations who are at the front lines of this crisis, supporting very at risk or under pressure communities. And I'm grateful to all of my fellow investigators, RAs, and to our partners for this assistance. The main part of this talk is going to be focusing on 5 emergent themes coming out of this research. And to precede that, I wanted to give some information about the approach and data of this study. So this is largely a qualitative piece of work where we are seeking to interview, using a semi-structured instrument, people in affected groups across the 4 populations. And we're also speaking with staff members and organizations and services supporting them. To get at some of the populations where we can't do interviews easily, such as those in prison, we've also adopted other data collection strategies, and we're being provided a huge amount of secondary data by our partner organizations. So overall, at this point in time, we have over 250 responses to our various forms of data collection, and that is detailed, rich information from people reflecting on and sharing their experiences of COVID and of lockdown. So the 5 themes that I wanted to talk about today are not the only themes that are coming out of the research, and we haven't even begun to properly analyze this mountain of data we have, but these are themes that are beginning to emerge in what we've been seeing and hearing as we go along. And these are related to information, digital exclusion, mental health impacts, the gendering of lockdown, and then I'm grouping together a final set of themes around ideas of hope and time and a list of the other emergent issues. So just to start off with our first theme of information, I think Tony in some ways addressed this as well, but we've broken it down based on our data into a number of dimensions. First of all is accessibility, and that is there's a huge amount of awareness of the broader messages around COVID restrictions and safeguarding practices, but there's also a huge amount of quantity of that information. So accessibility we're finding as a quantity issue, as well as an issue about targeting information for particular groups of people where there may be barriers or needs to communicate in different ways, including language difficulties or different kinds of formats for impairments and so on. One thing that we would note here is that we are hearing over and over and again about the vital, crucial role being played by absolutely tiny organizations of 0, 1, 2 paid members of staff type organizations supporting people in communities. And these organizations, for the most part, have no capacity to translate huge amounts of information into specific, precise information for groups. And that's just one of the things that's coming out. The second theme related to information is around specificity. So as the general advice and universal understanding of safeguarding measures like hand washing, social distancing, and masks is widespread, what we are looking for now or hearing from people in different kinds of situations is that they don't understand how information is relevant to them or what particular actions they need to take given their situation, whether that's a health condition like diabetes, whether that's somebody who is a refugee who's also trying to figure out how to balance a child's schooling or so forth. So there's a specificity of information issue arising. The third dimension of information is that information provided is not very useful and can't be actioned if there's no help that's matched up to it. So unmanned telephone lines or leaflets and general newsletters that offer advice but don't back that up with further match support around people, money, technology, or practical support is not going to produce the kind of action that's needed. The final thing of information that is really coming strongly out of this research is the emotional impact of information or lack of information. And this picks up on a theme that Anton mentioned in terms of radical uncertainty. Everyone we're speaking to is acknowledging heightened levels of anxiety and fear, and it's tied to this total uncertainty about how long or how deep the current pandemic and restrictions will go. And every new source of information has the potential either to ameliorate or to exacerbate that emotional impact. And you can see from some of the excerpted quotes on the side here how people are expressing those emotions. The second theme that we wanted to talk about was around digital exclusion, and to point out primarily that it's not just an issue of technology or training. Before that, though, I think it's important to point out we're hearing lots of really positive things, that the transition to online services and decline of face-to-face interactions for many has actually produced some positive results, so that people, particularly those who are formally excluded from accessing services, now have a new route into that. So people being able to attend church services or group meetings where they otherwise didn't have a car to travel or were a physical impairment that prevented them now can do that. But overall, exclusion is a dominant theme among the groups that we've been researching, and that is partly a function of the multiple forms of inequality and exclusion these groups are experiencing that might have to do with a disability or destitution or financial situation, physical isolation, or something else. So this goes to the point of the headline, which is that while we might want to think that if we could just resource some more equipment or training that this would solve it, there's actually quite a lot of social dimensions and practical issues that seem to also add to this barrier of digital exclusion. And that might be where people are not comfortable interacting online, and they may have real anxieties or issues around that, where there's multiple elements, where it's not just one individual's exclusion, but it's multiple individuals. And that certainly is an emergent theme across all of the research as well, is that these are community level issues, not individual level fixes, so that people are not able to communicate as effectively as they want to, and they won't be able to if we address these issues on an individual basis. The final element that I raise in terms of digital exclusion is more of a speculative cautionary note that in the creation of digital routes of engagement, which largely have been aimed at empowering and including people, there also is a risk to that of potentially coercive and surveillant uses of digital technology. We can see examples of this in terms of state interactions where families who are visiting a family member in prison via a video tablet are given strict rules about how they have to look and behave in that video, and it's unclear how prisoners would be disciplined if those aren't followed, where there may be a disability assessment via video. In other words, places where the state now has a direct line into seeing somebody's home. There's also a personal dimension to this, particularly arising in our domestic abuse and sexual violence survivor group around digital technology providing a new route of control by abusers. The third of the 5 themes that I wanted to talk about was around mental health impacts. These are universally being mentioned across all 4 of our study populations. And given that all of us seem now to be fluent in the language of mental health and the stigmatization of talking about that is reducing, that's great to know about, but it becomes a very generic, vague reference. And so one value I think that we're seeing in this in-depth qualitative research is we're able to dig into specific and nuanced ways that mental health is being impacted. And sometimes it's happening in what seem like very small ways, where somebody writes about missing a hug or physical touch. It might be around just feeling stressed or isolated or lonely, but all of these are intersecting on top of pre-existing levels of inequality and exclusion. And we're moving towards wondering whether this might be something like what is being talked about with physical health with the pandemic around long COVID, that long COVID might also have mental health dimensions as well, that there's a long and enduring sense of these accumulating mental health impacts that will produce profound consequences. It reminded me of the recent work by economists Anne Case and Angus Deaton on deaths of despair, looking at how working class men in America, through economic exclusion and the flooding of their communities with pharmaceutical opioids, has actually reduced the lifespan for certain groups of people. And while they talk about this in terms, and they look at mortality rates, on the other side of that are, and during the course of this pandemic, are longer periods of enduring and living with despair and uncertainty. Okay, the fourth theme around gender and lockdown is echoing what's been found in a number of other pieces of social research, that women are disproportionately affected in this lockdown. So across our 4 study areas, we see women disproportionately affected both as service users, but also in running these tiny grassroots community organizations and supporting people in their communities. They also have more typically childcare responsibilities or elder care responsibilities that are adding to the burden of whatever else they're facing. At the same time, though, this role of women means and suggests that they're more socially networked, and one potentially forgotten group among this is men living on their own. And we're seeing many men for whom we are gathering a sense of concern because there is extreme and deep forms of isolation, where our researchers, for example, might have been the only person someone has talked to in a week. And there seemed to be less engagement with services and less services available for this particular group. Finally, gender is not something that impacts on its own, but it's deeply intersectional. And we have a high level involvement of BAME communities in our research. And we see the ways that cultural, religious, ethnic, disability, and health issues cut across gender and other forms of inequality to affect the ways that particularly women are coping and men are being isolated. All right, I'm moving on now to the last theme. I have no idea where I am with my time, but I hope I'm okay. And this is to draw attention to the issues of hope and time. And didn't want to be entirely bleak about this, because we are learning a lot of and hearing many positives around how people are coping and things they're doing, or positives they're seeing in restricted environments. And this is from, maybe not surprising, because we are speaking with people who have long experience of facing extreme struggle, including experiencing violence, traumatic bereavement, social exclusion, and physical confinement. At the same time, I caution against using terms like resilience or strength or admiration, for the risk of normalizing the suffering, the deep suffering that people are going through, and maybe not planning for or anticipating or responding to potentially catastrophic effects of what all this coping is going to produce. And indeed, within the research groups, we are seeing a potentially significant subgroup within our population that's very close to the edge, who aren't yet on the radar of any particular services, and who may not show up in a time bomb type way as an explosion, but are experiencing hunger, experiencing significant isolation or despair, experiencing significant interruption of medication or health struggles, where we might expect them to show up in their 1s and 2s and 5s in police, in A&E, in NHS, in mortality data. And these won't necessarily be deaths that are labeled associated with COVID, but they're the effects of how lockdown is affecting huge numbers of people. So this is really a very selective discussion of what we're starting to see in the data we've collected, and we've yet to explore themes that also seem like they're likely to be salient, including the idea of loneliness in the context of what are often quite crowded households, concerns about food security, children in a number of ways, people who are shielding and may not fall specifically within guidelines for shielding, and the fact that that carers are also people with their own conditions and need caring for, and that this is very much a community impact of lockdown. And there's some final issues around medication that I could talk about as well. I'm just going to conclude by giving some details of our research study about how you can keep in touch to learn more as we publish more of our results. We also are collecting, because we've had such good response to this work, we're also collecting anyone's stories about lockdown, whether you fall into one of the particular population groups we're looking at or not. And that is a sister website called Lockdown Stories, where we're hoping we might be able to promote something like a civic debate and oral history of what Scotland is going through right now. So thanks very much.
I was on mute, sorry. Thanks. It's quite a whirlwind tour of an awful lot of research, but quite impressive amount of work going on there. John, are you ready to take over?
I am hopefully firing up my screen just now, so that everybody will be able to see what I'm doing. Okay, I'm going to cover three basically unconnected issues about the politics that surrounded the pandemic. In particular, three subjects as to consequences it may or may not be having. One is simply to look at what's been the impact of the pandemic on levels of support for the political parties across Britain as a whole. The second, getting a little bit closer to home, the apparent influence that perceptions of handling of coronavirus may have had on attitudes towards independence. And then thirdly, and very briefly, using some data collected from a UK ESRC COVID-19 emergency response grant I'm running, just a little window on whether or not people's attitudes towards welfare, particularly welfare for people of working age, may or may not change in the wake of this pandemic. There's a lot of discussion about how we are going to have renewal and the world is going to be different, and I'm interested in whether or not actually public attitudes are actually being shifted at all by the pandemic. Okay, so number one, how do people think that the UK government has been handling the coronavirus? And I'm going to take the data from a couple of companies, but they both tell the same story. This is YouGov, and then we have Opinium. Let me go back to YouGov because it's slightly more dramatic. As you can see, in the early weeks of the lockdown in April, we were getting 60, 70% of people saying that the government was handling the coronavirus pandemic very or somewhat well. And then we hit the month of May. Two things happened in May. One is that on around May the 11th, the Prime Minister made a broadcast in which he indicated that lockdown was coming to an end, and everybody was left wondering whether or not they were meant to go back to work on the following Monday morning. I.e., it proved to be a speech that was perhaps one of many where the public weren't always entirely clear what the message was going to be. And then, of course, towards the end of May, there was the famous Dominic Cummings visit to Barnard Castle. And as you can see, by the end of that, people's perceptions of the handling of the coronavirus were much more negative. It then basically flatlined during the course of the summer. But then in recent weeks, as the numbers have started to rise, so confidence has fallen away again. So again, this is YouGov's data. Same of the thing with Opinion, like most recent of which came out yesterday. 50% of people, according to them, now are saying that they disapprove of the government's handling the coronavirus. 30% disapprove. And it does look as though that this has had an impact on the standings of the parties. So back in April, when we all thought that Boris Johnson was doing brilliantly, even though he was stuck in hospital, support for the Conservatives peaked at 50% on average, and only around 30% said they're going to support the Labour Party. By the time we got to the middle of June, in the wake of Dominic Cummings' affair, the Conservative lead had fallen away to 5 points. It then basically flatlined. And now again, most recently, it's on average down to 2 points. One poll yesterday actually had Labour ahead. That's the first one since Boris Johnson became Prime Minister. Now, the Conservatives are still ahead, and they would probably still emerge from a general election as the largest party. But once you get down to 2 points, you're at the point where it's possible that all of the opposition parties might actually be capable of displacing an incumbent Conservative government. What, of course, is perhaps also interesting is what impact, if any, has any of this had on the division of support between Remain and Leave voters, because the support for the Conservatives in December of last year was very, very much focused on those people who voted Leave. 74% of Leave voters voted for the party, whereas the Labour Party was doing much better amongst Remain voters. Well, as you can see, actually, the Conservatives have largely held on to such Remain support they had. They've still got about a fifth of them. And the concerns about the handling of Brexit do seem to have helped to erode to some degree support for the Conservative Party amongst those who voted Leave. Some of this seems to have gone back to the Brexit Party, and quite a lot of them are just simply saying, don't know. The Labour revival, such it is in contrast, however, has occurred amongst both Remain and amongst Leave voters. And the fact that the Labour Party's got back up to 38% of the vote without doing particularly well amongst Leave voters does raise a question mark about the widespread presumption amongst the commentariat at the moment, which is the Labour Party needs to regain ground disproportionately amongst so-called red wall Leave voters in order to get back to a position where it could displace the current government from power. The events of the last 6 months have arguably raised doubts about the validity of that presumption. Labour may simply be able to gain ground by benefiting from the claims of incompetence labelled at the government, which ends up enabling the Labour Party to gain ground amongst both sides of the Brexit divide. Okay, number two, the impact on the debate and public attitudes towards independence. This is just a reminder of what the opinion polls have been saying about how people would vote in a second independence referendum, basically from 2018 onwards. Point one to note, if you look at the kind of second third of the graph, where you begin to see the division between yes and no narrowing, it was already the case before we hit the pandemic that support for independence was rising. That's largely to do with attitudes towards Brexit. But you will then also notice on the far right-hand side that as we've got into the last 6 months or so, that we've begun to get into a world for the first time in Scottish polling history of majority support for yes. How do we explain this? Well, it's not Brexit. This graph shows you how until the January, February of this year, all of the increase in support for independence was occurring amongst Remain voters. That's why Brexit was driving it. But the most recent increase in support, as you can see on the far right-hand side, has occurred amongst both Leave and amongst Remain voters. So it's not Brexit what's doing, but is it coronavirus? Well, the evidence is circumstantial, but it's pretty powerful. We should remember that one of, not only is coronavirus the biggest economic challenge since 1945, it's also the biggest challenge that's faced the devolved institutions since 1999. It's a high-profile issue, but it's an issue on which the health and the public health issues decisions have been made in Edinburgh rather than in London. And these are just one of a number of surveys that basically tell you that people think that Nicola Sturgeon has been handling coronavirus very well, and they think that Boris Johnson has increasingly been of this view that Boris Johnson has been handling it badly. We might want to debate why that's the case, given that perhaps the epidemiological record is perhaps not quite so starkly different, but perception, which is crucial in politics, is very, very different. And it does look as though that this probably has fed into some people's views about the merits or otherwise of the union. Exhibit number one, asking people whether or not the handling of coronavirus has either made you more confident of Scotland being part of the union or more confident of independence. And basically, amongst those people who voted no, there are as many people who think that the handling of coronavirus by Sturgeon has made them more confident of independence, as has made them less confident. And meanwhile, when it comes to Boris Johnson, no voters are now more likely to say that they are less confident of governance via the union, than they are to say that they are more confident. So basically, evaluations of Sturgeon have fed into some people's confidence in Scotland as an independent country, and evaluations of Johnson have had a negative effect on their evaluations of the Union. And then, crucially, only 4% of those people who voted yes in 2014 now say that the handling of coronavirus by the Scottish government has, they think that coronavirus would have been handled worse if Scotland were independent. 70% think it would be better. Well, you might think the 70% is not surprising, but here's the crucial number. 20% of those people who voted no in 2014 think that an independent Scotland would have dealt with coronavirus more effectively. And that 20% is much bigger than that 4%, and almost undoubtedly seems to have driven some people's views on independence. Okay, finally and briefly on what is a very big topic, but we're also, my slides for some reason or other seem to, and that's because I've probably got the wrong one that's open. But anyway, let me just tell you very briefly that what they show is that when it comes to attitudes towards taxation versus spending, one of the things that we have seen in recent years is a gradual emergence of people coming out of the years of austerity, people gradually saying, well, actually, we should be spending more, and I'm somewhat less concerned about reducing taxation. And when we last asked people back last year, before the pandemic, just over a half of people said that we should be increasing spending. That figure has not shifted when we have gone back to people, many of them the same people that we interviewed last year. We're back to still just over a half. So you can read that one of two ways. One is that actually people have accommodated themselves to the increase amount of spending the government's engaged in during the course of the pandemic so far, and they're not reacting against it, which is one of the things that could have happened. But equally also, there's no clear evidence that we're saying we want government to be more interventionist. And then more broadly, when you look at people's attitudes towards unemployment benefit and the payment of welfare payments, what you discover is that it's not clear that attitudes in the pandemic are markedly different from what they were immediately beforehand. However, in the 3 or 4 years before the pandemic, it was already the case that some of the relatively anti-welfare views that had emerged under New Labour and in the early years of the coalition government, that some of those views already unraveled. We'd already begun to become more liberal in our attitudes towards welfare. So we've entered a world where actually we are probably rather more concerned about the level of welfare for those of working age than was the case certainly 5 or more years ago. But again, it's not clear so far that it's pushed our attitudes any further. But of course, as unemployment increases, maybe that change will occur.
Thank you, John. So yet another talk that could easily, we could easily have at least an hour for all of these talks. So apologies to people attending that we have to cut them all short and move on. In fact, actually, we don't have an awful lot of time for questions. If we were going to end on sort of normal Stevenson time, I think we can probably stretch a little bit since we can't offer everybody a glass of wine afterwards as we would normally do. But we will have to sort of take snappier answers to questions, I think, than what we might normally do. So I did promise, since Karen put in so much effort in organizing, to turn over to Karen for the first question, and then I'll go through the Q&A as best we can. Karen.
Thanks, Chris. Not sure that was quite fair of me. I have a question for Tony and a question for Anton. Question for Tony has to do with centralization. How well, it seems like much of the efforts have been in addressing some of the messaging and the public health approaches to COVID have been centralized. to some degree, but then decentralized if you look at the UK and Scotland. So my question is, how well has centralization served the efforts to combat the pandemic? And are there ways that you would advise us to be either more centralized, maybe it's some international cooperation, or less centralized in terms of those approaches? And question for Anton was, I was intrigued by your comparison of COVID to a world war in terms of its impact economically. And I wonder if there has been much discussion of the use of something like war bonds, where individual savings, which seem to be accumulating a bit more because people aren't going out and doing as much as they might otherwise do, could be brought to bear to help support some of those government expenditures on critical things like income support.
Shall I start first, or? I think it's a very good question. So, I mean, there are certain things that I think centralized approach is useful in terms of testing, procurement. I think those things are important to have a national strategy, and I don't even know the ins and outs of procuring PPE, for example. But I think a national approach, and in terms of testing, you know, using the same reagents, using the same tests, and we have tried to do that for for antibody testing, currently mostly used for kind of research approach, but there are a lot of literally hundreds of different antibody tests, and to allow comparability in terms of kind of seroprevalence, you need a centralized approach. Messaging is difficult because I think on one hand, you do want a centralized approach just because I think the different rules for different places has caused a great deal of confusion. On the other hand, the pandemic has affected different regions differently. How much of that is due to different approaches, I don't know, but certainly the pandemic has affected Scotland very differently to England. We were always a little bit behind. And even, over the summer, we were having single figures, less than 10 cases for certain periods of July, whereas in England, there were still over 1,000 cases, in some days. So I feel like taking a regional approach was appropriate to an extent. So I think I haven't answered your question very well, but I think some things are better centralized. But I think, when the outbreak has affected different regions, applying local lockdowns, I feel like has been a useful approach, so that it's not a blanket, that everyone doesn't have to suffer if there are, high prevalence of cases in different regions. I'll hand over to Anton.
Thanks, Tony. So Karen, yes, good question. I gave the comparison, as you say, to war bonds, because what's happened during the war certainly is that you had redeemable bonds like consols being issued, which avoided the need for government to refinance at a time where it wasn't certain how long the war effort had to continue. The other reason for doing it is, of course, that there's a certain element of sharing across generations, and for instance, we know that the current COVID crisis is impacting more on young people. I mentioned particularly young people entering education and leaving education over the next few years will probably be scarred more in terms of the labour market outcomes than those who are already in jobs and whose jobs remain secure, and those who will come after the COVID crisis. So in a sense, it's almost also a device for some degree of smoothing of the outcomes so that more can be spent on those who are suffering more now. Sort of war bond type sort of savings bonds, I don't think those are necessarily part of the equation at the moment. That's partly because it was an attempt at a forced savings on the part of governments during war, essentially, as you say, trying to mobilize savings towards the war effort. I think one of the concerns with that would be, what are the distributional impacts of that if you tried to do anything like that at a time when, well, frankly, we would like to hopefully get out of the COVID crisis quicker than than a world war, but also because you can do more flexible things with tax policy in terms of distributional effects than trying to distort potentially impact through forced savings and the kind of war bonds that war savings bonds that you mentioned. The worry would be that it impacts. It doesn't bring sacrifices in the right place. You'd be better, if you were worried about the progressivity of some of the measures, it'd be better raising progressive taxes.
Thank you, Anton. An interesting side fact that as we're looking to the 100th anniversary of the Stevenson Trust next year, found out that the original endowment was Sir Daniel Stevenson giving the university war bonds that he had. So Anton, a question for you, I think largely. There were several questions around the general theme of the sort of university's investment strategy and its place in the world. So I don't know if you want to address those. Particularly, it does raise the interesting question that if there are a variety of things that the university could or maybe might or might not invest in, are those linked to things like climate change and then obviously extension of the current situation?
Yeah, no, thanks, Chris. I'll try and keep it short because I know this is only marginally related to the COVID theme. The university certainly made a commitment to divest from fossil fuels, and that's something which was subject to review, but it's something we're looking at. And all these things also have to be balanced against also trying to enable a transition, because we know that it's not simply about divesting from certain companies, it's also about encouraging certain types of investment. So I think, when I look around and I look at, investment funds that are trying to bring a sort of socially responsible approach to that, it's a nuanced approach. Some of it is around removing investment, some of it is about actually engaging with companies and saying, we will disinvest if, or reviewing what they're doing. So it's never a black and white policy. The university's investment strategy, as you know, is determined by the university court. So it's not a matter simply for me. In terms of the wider mission of the university, I know there was a question about this. It's really important that the university isn't a for-profit entity. We don't make a profit. Sometimes there's a slight conflation of things because universities will report operational surpluses, which sound like profit, but they're not. Essentially, what we do there is simply reinvest that into people, into buildings, into IT equipment. Indeed, many of the things that we've needed to do during the COVID crisis, such as investment in IT, have come from exactly that. So, and actually invest in the next generation. So we are very much an educational institution, and we will always put education and care at the top. And we don't run surpluses. Profits. We don't make profits. We run surpluses to reinvest in our activities.
Okay. There were a couple of links here, and then it's a question that we've seen I think in the media a lot, which is the relationship between climate change and the spread of COVID. Tony, I don't know if this is starting to fall outside of your comfort zone of expertise here, but has there been research that you've seen about the relationship between climate change and spread of COVID?
It definitely falls outside my area of expertise. I did look at that question, and it had something to do with humidity. What we do know is that coronaviruses, seasonal coronaviruses, so that there are a number of coronaviruses that have existed for a long time, not MERS or SARS, that cause the common cold and can cause severe illness in special populations like immunocompromised people. We know that the seasonal coronaviruses, like cold temperature, thrive in cold temperature and tend to cause outbreaks and circulate in cold weather, very similar to flu actually. So I guess that's the concern, going into winter, maybe partially why we see increased number of cases. There have been a lot of studies in flu in particular about certain environmental conditions, for example, high, low humidity and cold dry weather that only works for temperate countries such as the UK, but actually it turns out that in other settings, like in tropical settings, I work in Malawi in particular, in those regions, actually flu and maybe some other respiratory viruses tend to thrive more in rainy season and warmth. So I don't think it's straightforward. I think there are different conditions under which different respiratory viruses thrive. We have been studying flu for a long time and we still don't have that straight. I think we're only starting to find out what conditions SARS-CoV-2 transmits, and I'm not aware of any in particular research so far that has linked it to climate change so far.
Thanks for that. Sarah.
I was just going to come in on the climate change issue, is that it's also a social issue, and that climate crisis is driving different kinds of migration and scarcity of resources. So being a Californian, the wildfires right now out west are going to have significant impact, first of all, on the lives of people living there, but is also going to have impact on migration patterns of the United States and the pressures that creates on the kinds of resources that are needed to support people. And that's sort of what our study is partly looking at, people in situations of being refugees or asylum seekers. I think we see some of that's war driven, some of that's climate driven, some of that's both.
Yeah, obviously climate change is, as Tony started off with her remarks at the very beginning, the need to look across multiple disciplines and multiple ways of thinking about these things and how the major issue. I'm sure Stevenson will be returning to that at some point. A question that cuts across, again, multiple talks that we've had is about the impacts of working from home and how that relates. And Sarah, I imagine that there must be some of that in the research that you all have done, but then also with the economic impacts of that, Anton. What this massive shift that we've seen in us all here working from home. How is that playing out?
I guess I can speak to that just in terms of our study, particularly we did a survey of organizations providing services to stretched communities, and just the level of working longer hours, working without leave, using their own money, not just telephone equipment or computer equipment, but own money to keep their work going at home is unbelievable. And I'm not sure how that's being compensated, but there's also a spirit at the moment of helping out. And so even though people are saying they're spending their own money to work from home or losing their holidays, there's a sense of, but this is important, and I'm not going to say this is a negative thing. It's something I willingly do because it's needed. And I just wonder over time, though, there's going to be huge levels of burnout and so forth. On a smaller level, we're all working from home as well, so in terms of like research funding and stuff like that, I inquired with our own university about, we're getting charged to states to, like light and heating to my research grant. But, so I think there are huge issues, both personally, but within the research that we're seeing.
I mean, I'm happy to come in very briefly, Chris. I mean, I think this is one of the real uncertainties about what happens post-COVID. Will there be a major change in working patterns? And I've seen all sorts of differing predictions, those who think there will be a dramatic change, and certainly in terms of some of the other objectives around climate change and reducing, commuting, etc. That would all be positive. The negative will be that there will be also some inequalities if you start having mixed mode, where, I mean, at the moment we're all in a single session, we're all on an equal basis. I mean, there will be inequalities of access, as Sarah's pointed out. But once you start moving to a mixed modality where some people are present and other people are not, that then leads to other disadvantages. And I think all that is, in the world of work, is still to be explored. And not an expert, I have to say, but I think that's going to be, I don't think we'll see exactly how this pans out. I do hope we don't just simply go back to where we were, because otherwise we lose the advantage we've created in terms of reducing transport and reducing commuting, etc., and the potential impact, positive impact that has on climate change.
Thanks. It's a question from Andrew Judge for Sir John. says, you mentioned that there has been no real shift in attitudes towards government intervention during the pandemic. However, there does seem to be some skepticism from some about the lockdown measures. Has a gap opened up between those who are supportive of government restrictions and those who are opposed, skeptical? If so, does this map onto the Remain Leave divisions, or is it unrelated?
The honest truth is that the predominant view amongst the public is still to be supportive of whatever lockdown measures are put in place, and B, to feel that the lockdown, measure that we're being too lax in dealing with the pandemic rather than too tight. So although there has been a quite vocal concern about the tightness of the measures amongst some conservative backbenchers, and therefore to some degree amongst conservative supporters, and there is, then that's on to Remain and Leave. You have to be aware that actually the dominant mood amongst the public is still to be supportive of measures and to be concerned about what they still feel is the relative speed of trying to ease. So it's an asymmetric division. Yes, it does map to some degree on Remain and Leave, but by no means perfectly so. But that's probably about as far as we can go.
And Scott Simpson asked a sort of a corollary question. What about what's coming up in May? How does all this map onto your expectations about the Scottish Parliament elections coming up?
Well, I mean, it is no secret that the SNP are currently running over 50% in the opinion polls north of the border. They were pretty much at that even before the pandemic started. But the honest truth is, of course, is that, insofar as the current position of the SNP is dependent on evaluations of Nicola Sturgeon's handling of the pandemic, there's an awful long time to go between now and next May, and plenty of opportunities for things to go wrong. And the truth is that in recent weeks, Scotland has been suffering a second wave as badly as England has done. Now, that might make a difference, or it may be that the fact that the style and the manner that Nicola Sturgeon has used, which is so different from that Boris Johnson, is what is crucial. Who knows? But I mean, there is no guarantee that by May of next year, the Scottish public are still thinking that Nicola Sturgeon is doing brilliantly handling the pandemic. And Boris's optimistic scenario is that sometime between now and May, either the Oxford or the Imperial vaccine has been shown to be efficacious, and at least some people have been vaccinated, and he will say, there you go, British bulldog spirit has defeated the virus for the world. And perceptions may well change.
I think Donald Trump is hoping for that before the 3rd of November, actually, but
Well, it's got a slightly better chance for Boris than it has for Donald, but anyway.
So there's been 2 or 3 questions, and I realize that we need to start heading towards wrapping up some of these, and I'm afraid we're not going to be able to get to all the questions in the Q&A. But sort of starting to bring some of them together. Just put this across the panel to all of you. Something along the lines of, does the panel think that that lessons have been learned, whether that's from politicians or the researchers in all sorts of different areas, public health officials? Can we handle crises better in terms of, has emergency management perhaps learned lessons from the current situation? And I suppose to be fair to a couple of the questions, to bring it around, also lessons for the university about the current situation and going forward. So not sure where to start that. Maybe start with Tony, if that's all right.
I wonder if it's too soon to think about that. Certainly working as a doctor in the NHS, I think we have definitely learned a lot about how to manage patients. You know, with the volume of information and research studies that come through, there have been some really great epidemiological studies and also trial results showing, for example, that steroids can cut mortality by up to 1/3 in patients who are needing a mechanical ventilation and 20% in those who need oxygen. So it's a cheap, effective drug. There are now a number of clinical trials on antivirals and drugs that modulate your immune system. We also know better how to kind of ventilate patients. So I think from a medical perspective, I think we have learned, and I think we will cope with this coming season, not knowing what the additive effect of having flu as well will be. That's a great unknown. With regards to the kind of public health side of things, I don't know. I think to kind of reflect and learn lessons, you also need to pause. And I don't feel we've really had that time to do that. I feel like we've been firefighting nonstop. You know, as a kind of researcher, it's just really been nonstop and try. You know, I feel like we need some time to reflect. And I thought we would have more time, but actually, it feels like the second wave is coming sooner rather than later, and may not have real time to really assess what if the response has been correct. Could we have done things better? But I definitely think that needs to be done going forward.
That's a really good point. John, I know you need to be away before too long.
Yeah, just very quickly and pithily. One person who doesn't seem to have learnt how to manage the politics of the pandemic is frankly the Prime Minister. The UK government, I mean, he is somebody who is known as somebody who is always wanting to paint the vision of a brighter future and to suggest that the best is best for all possible worlds. That has led to repeated occasions whereby the UK government has made big announcement. The details come a few days later, and then a few days or maybe a few weeks after that, we discover that actually not very much is happening at all. That's been a perpetual cycle. And in a pandemic, don't overpromise and underdeliver, because it does nothing for people's confidence in what you are doing. In contrast, the stance of the First Minister, who has made plenty of mistakes, but has been willing to make mistakes, and who's basically been saying, I know this is terrible, this is awful, it's as bad for me as it is for you, and not promising that there's going to be some great victory over the virus tomorrow, so far seems to have been a much more effective way of handling the politics of the pandemic.
Sarah, lessons learned.
I typed a response to a question that came in about universal basic income, and I just instantly said yes, and then the question disappeared, so we didn't get to discuss it as a panel. And I think, one of the things that seems like it would be useful is addressing fundamental levels of exclusion and inequality regardless of a crisis, and creating a foundation of support and equality is the best situation to be in when you do hit a crisis. So the fact that there are disproportionate effects and different performances of countries is partly a function of how equal those societies are anyway. And we see that, exacerbated by leadership issues, whether it's the US or the UK level government. And so, and I think there's like a certain level of trust, and, despite having populist led leaders in the UK and US, there's also like this real suspicion that people won't use money well. And what we're hearing from people is how even tiny amounts of money would make a huge amount of difference for taking the edge off of some of the worst effects of what they're going through, in ways that no government or centralized authority could understand how to deliver aid in that area. Everyone's making individual choices, community level choices, and I think there needs to be a level of trust. And so, from a personal, increasingly research point of view, I think universal basic income and those kinds of broad-based egalitarian supports are justified and would help in these kinds of situations.
Thanks. Anton, I don't assume that Rishi Sunak is going to be adopting a UBI anytime soon, but economic lessons that we might think of.
Yeah, I might come back to the whole issue of support in UBI at the end, actually, Chris. But before I do that, I'm a bit like Tony. I think some of the lessons around the economic instruments that work and don't work, I think we've got to see exactly what happens in this phase. In a sense, if I look at the interventions during the summer, that was the easy bit in many respects. We're now coming to the difficult bit where we know that there'll need to be a transition to the post-COVID economy. And what are the instruments that are going to facilitate that without having mass unemployment, without having people, you say, in economic distress? And those are the bits that the design is much more complicated than just freezing the whole economy. As I said, issues like, which companies will survive, which companies can survive. It's a really tricky area. What are you about the university? And I mean, one sentence on that, but I think it's caused us to reflect quite a bit. If you look at the COVID-based research we've done, how quickly we've managed to mobilize certain type of research. And I suppose it's trying to say, well, we need to look at what the next crisis will be, how we position ourselves, in which bits of the current research that we've done in response to COVID really needs to be there, because there may be other types of, I think some of the comments made it clear there might be other types of transmission of disease from animals to humans. We need to, can you imagine if if some of those vaccine programs that we're currently wanting to rely on hadn't been maintained over the last 5 to 10 years, we would be in an even worse situation. And let me briefly touch on Sarah's point about UBI. As an economist, I quite like to look at a complex set of interventions there, because I think sometimes the one thing that's deceptive about UBI is that it's a single instrument that works, for all ills. And instead, I think Sarah's point is really important: is which are the interventions that are going to allow us to deal with situations around disadvantage? And I mean that both within a country, but also, COVID's going to have a differential impact, as I said, across different countries. The effect on the low and middle income countries potentially of COVID will be long lasting, even as the advanced economies are recovering. So we need to look at a whole range of interventions. And I'm, for instance, somebody who prefers poverty relief type programs to UBI type programs, because the problem with UBI is that it benefits also people who frankly need help less. But look, that deserves probably a whole set of lectures in itself. I would rather have 5, 6 different types of interventions in this space, which will be UBI-like, but as opposed to a single instrument.
It just so happens that we may well be looking at that as a topic for next semester, I believe. So we may return to that for a long time. I'm looking at the time and conscious that we need to wrap up. Unfortunately, we couldn't get to all the questions in the Q&A. That's the way it often happens at the Stevenson events. We have to end up stopping at some point. So I would like to thank all the panelists, including John, who has had to duck out a bit early. Thank you all very much. It was, as we said, I could have easily had just an hour for each of you. So we do very, very much appreciate it. And maybe after we actually do have a chance to pause at some point, and after we've managed to catch a breath, hopefully in the not too far distant future, we could reconvene and actually start thinking about some of the lessons, because that is certainly, most of the public policy models out there actually say exactly what Tony said, is that we are going to need a chance to pause. We are going to need a chance to think. We're going to have to start putting some of the pieces together before we can really draw some of the lessons. So thank you all very much. Thank you for those who've stayed till the end. And we will see everyone again on the 8th of October for Lord McConnell delivering the first Stevenson Donald Dewar Memorial Lecture. So thank you very much.